Hi and welcome viewers of Nursing Academy 101. In this video we will talk about the challenging NCLEX-RN and Prometric practice questions along with their answers and rationales part 1. But before we start, please, do not forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question 1. A client is admitted to the emergency department with suspected meningitis. The nurse should prioritize which intervention? A. Administering analgesics for headache relief. B. Obtaining a lumbar puncture for cerebrospinal fluid analysis. C. Administering antibiotics as prescribed. D. Initiating droplet precautions. Answer. B. Obtaining a lumbar puncture for cerebrospinal fluid analysis. Rationale. Meningitis is an inflammation of the meninges surrounding the brain and spinal cord. The most critical intervention in suspected cases of meningitis is to obtain a lumbar puncture to collect cerebrospinal fluid, CSF, for analysis and to determine the causative organism. This procedure is essential for making an accurate diagnosis and guiding appropriate treatment. Options A, C, and D are important interventions, but obtaining a lumbar puncture takes precedence in suspected meningitis cases. Question 2. A client with heart failure is prescribed digoxin. The nurse should monitor the client for which potential adverse effect of this medication. A. Hypokalemia. B. Hyponatremia. C. Hyperkalemia. D. Hypernatremia. Answer. A. Hypokalemia. Rationale. Digoxin is a cardiac glycoside commonly prescribed for heart failure. One of the potential adverse effects of digoxin is hypokalemia, which can increase the risk of digoxin toxicity. Low potassium levels potentiate the action of digoxin on the heart, leading to arrhythmias and other manifestations of toxicity. Therefore, the nurse should closely monitor the client's potassium levels while administering digoxin. Question 3. A client with chronic kidney disease is prescribed a low-phosphorus diet. Which food choice by the client indicates understanding of the dietary restrictions? A. Grilled cheese sandwich. B. Scrambled eggs with bacon. C. Baked chicken breast with steamed broccoli. D. Spinach salad with sliced almonds. Answer. C. Baked chicken breast with steamed broccoli. Rationale. Clients with chronic kidney disease may need to follow a low-phosphorus diet to reduce the workload on the kidneys. Option C, baked chicken breast with steamed broccoli, is a suitable choice because chicken and broccoli are low in phosphorus. Options A, B, and D are high-phosphorus choices and should be avoided in a low-phosphorus diet. Question 4. A client with bipolar disorder is prescribed lithium carbonate. The nurse should inform the client about which potential side effect of this medication. A. Weight gain. B. Excessive thirst. C. Hand tremors. D. Increased appetite. Answer. C. Hand tremors. Rationale. Lithium carbonate is a mood stabilizer commonly prescribed for bipolar disorder. One of the potential side effects of lithium is hand tremors or fine motor tremors. The client should be informed about this side effect, and the nurse should monitor the client for any signs of tremors while on lithium therapy. Question 5. A postpartum client is at risk for postpartum hemorrhage. Which finding should the nurse recognize as an early indication of potential hemorrhage? Answer. B. Lochia rubra with small clots. Rationale. Lochia rubra with small clots can be an early indication of postpartum hemorrhage. The presence of small clots suggests that there may be bleeding from the placental site. The nurse should closely monitor lochia, uterine tone, and vital signs to identify and prevent postpartum hemorrhage. Option A indicates normal uterine contractions. Option C indicates a well-contracted uterus, and Option D indicates hypotension, which may be a late sign of postpartum hemorrhage. Question 6. A client with severe preeclampsia is receiving magnesium sulfate to prevent seizures. The nurse should closely monitor for which early signs of magnesium sulfate toxicity. A. Hypotension and tachycardia. B. Muscle weakness and lethargy. C. Hyperreflexia and respiratory depression. D. Hyperglycemia and polyuria. Answer: C. Hyperreflexia and respiratory depression. Rationale: magnesium sulfate is used to prevent seizures in clients with severe preeclampsia. However, it has a narrow therapeutic range, and toxicity can occur. Early signs of magnesium sulfate toxicity include hyperreflexia, increased deep tendon reflexes, and respiratory depression. The nurse should monitor the client closely for these signs and be prepared to intervene if toxicity occurs. Question 7. A client with a history of chronic obstructive pulmonary disease, COPD, is prescribed ipratropium bromide, Atrovent, inhaler. The nurse should instruct the client to use the inhaler correctly by A. Inhaling deeply and rapidly. B. Exhaling completely before inhaling the medication. C. Using the inhaler only during asthma attacks. D. Taking 2 puffs every 5 minutes during an acute exacerbation. Answer: B. Exhaling completely before inhaling the medication. Rationale: when using an ipratropium bromide inhaler, the client should exhale completely before inhaling the medication to maximize drug delivery to the lungs. Option A, inhaling deeply and rapidly, is more appropriate for short-acting beta-agonist inhalers. Option C, using the inhaler only during asthma attacks, is not accurate since ipratropium bromide is used to manage COPD. Option D, taking 2 puffs every 5 minutes during an acute exacerbation, is not the correct dosing regimen for ipratropium bromide. Question 8. A client with type 1 diabetes mellitus is admitted to the hospital with diabetic ketoacidosis, DKA. The nurse should anticipate the need for which intravenous fluid replacement initially. A. 0.9% sodium chloride, normal saline. B. 5% dextrose in 0.45% sodium chloride. C. Lactated Ringer's solution. D. 5% dextrose in water. Answer: A. 0.9% sodium chloride, normal saline. Rationale: the initial intravenous fluid replacement for a client with diabetic ketoacidosis, DKA, is 0.9% sodium chloride, normal saline, to correct dehydration and electrolyte imbalances. Once the client's blood glucose levels approach 250 mg per deciliter, dextrose-containing fluids may be added to prevent hypoglycemia. Option B, 5% dextrose in 0.45% sodium chloride. And Option D, 5% dextrose in water, may be used later in the treatment but not initially. Option C, lactated Ringer's solution, is not typically used in DKA management. Question 9. A client is prescribed warfarin, Coumadin, for deep vein thrombosis, DVT, prophylaxis. The nurse should instruct the client to avoid consuming large amounts of which vitamin while taking warfarin. A. Vitamin C. B. Vitamin A. C. Vitamin K. D. Vitamin E. Answer: C. Vitamin K. Rationale: warfarin is an anticoagulant medication that works by interfering with vitamin K-dependent clotting factors. Clients taking warfarin should avoid consuming large amounts of vitamin K-rich foods, such as green leafy vegetables and broccoli, as they can interfere with the medication's effectiveness. Options A, B, and D are not associated with interactions with warfarin. Question 10. A client with chronic kidney disease is undergoing hemodialysis. During hemodialysis, the nurse should monitor the client for which complication related to the dialysis procedure. A. Hyperkalemia. B. Hypocalcemia. C. Hypertension. D. Hypoglycemia. Answer: A. Hyperkalemia. Rationale. During hemodialysis, excess potassium is removed from the client's bloodstream. As a result, clients undergoing hemodialysis are at risk of experiencing hypokalemia. The nurse should closely monitor the client's potassium levels during and after the dialysis session to prevent hypokalemia. Options B, C, and D are not common complications associated with hemodialysis. Question 11. A client with heart failure is prescribed furosemide, Lasix, 40 mg for push. The nurse should administer the medication over which time frame? A. 2 minutes. B. 5 minutes. C. 15 minutes. D. 30 minutes. Answer. A. 2 minutes. Rationale. Furosemide, Lasix, is a loop diuretic that can cause ototoxicity if administered too rapidly. The nurse should administer furosemide 40 mg for push over 1 to 2 minutes to minimize the risk of ototoxicity. Question 12. A client with suspected acute appendicitis is scheduled for surgery. The nurse should place the client in which position to relieve pain and prevent rupture of the appendix? A. Fowler's position. B. Supine position with legs extended. C. Trendelenburg position. D. Right lateral recumbent position. Answer. D. Right lateral recumbent position. Rationale. Placing the client in the right lateral recumbent, SIMS, position can help relieve pain and prevent rupture of the inflamed appendix. This position promotes drainage of the appendix contents away from the general peritoneal cavity, reducing the risk of rupture. Options A, B, and C are not recommended for a client with suspected acute appendicitis. Question 13. A client with a history of coronary artery disease is prescribed nitroglycerin sublingual tablets for angina. The nurse should instruct the client to take nitroglycerin using which dosing regimen? A. Take 1 tablet every 6 hours for chest pain. B. Take 1 tablet every 30 minutes for up to 3 doses for chest pain. C. Take 1 tablet daily for prophylaxis. D. Take 1 tablet as needed for chest pain. Answer. D. Take 1 tablet as needed for chest pain. Rationale. Nitroglycerin sublingual tablets are used for the immediate relief of chest pain, angina. The client should take 1 tablet sublingually at the onset of chest pain. And repeat every 5 minutes for a maximum of 3 doses, if needed. If chest pain persists after 3 doses, the client should seek emergency medical attention. Options A, B, and C are not the appropriate dosing regimens for nitroglycerin for angina. Question 14. A client with multiple sclerosis, MS, is prescribed dalfampridine, Ampera, to improve walking ability. The nurse should instruct the client to monitor for which potential adverse effect of dalfampridine. A. Dizziness. B. Constipation. C. Weight gain. D. Hypertension. Answer. A. Dizziness. Rationale. Dalfampridine, Ampera, is a medication prescribed to improve walking ability in clients with MS. One of the potential adverse effects of dalfampridine is dizziness. The nurse should instruct the client to be cautious when getting up from a sitting or lying position to minimize the risk of falls. Options B, C, and D are not commonly associated with dalfampridine use. Question 15. A client with chronic renal failure is prescribed calcium acetate, Foslo, to manage elevated phosphorus levels. The nurse should instruct the client to take calcium acetate. A. With meals. B. On an empty stomach. C. At bedtime. D. 2 hours after meals. Answer. A. With meals. Rationale. Calcium acetate, Foslo, is a phosphate binder used to reduce elevated phosphorus levels in clients with chronic renal failure. The medication should be taken with meals to bind to dietary phosphorus and prevent its absorption. Option B, C, and D are not the appropriate instructions for taking calcium acetate. Question 16. A client with a history of alcohol use disorder is admitted to the hospital with acute pancreatitis. The nurse should monitor the client for which potential complication? A. Hypokalemia. B. Hypoglycemia. C. Hypocalcemia. D. Hypernatremia. Answer. C. Hypocalcemia. Rationale. Acute pancreatitis can lead to calcium sequestration in areas of fat necrosis, resulting in hypocalcemia. Clients with acute pancreatitis are at risk of developing hypocalcemia, which can manifest with symptoms such as tetany and positive Chvostek's and Trousseau's signs. Options A, B, and D are not directly associated with acute pancreatitis. Question 17. A client with rheumatoid arthritis is prescribed methotrexate. The nurse should instruct the client to report which potential adverse effect of this medication. A. Hair loss. B. Weight gain. C. Increased appetite. D. Photosensitivity. Answer. A. Hair loss. Rationale. Methotrexate is an immunosuppressive medication used to treat rheumatoid arthritis. One of the potential adverse effects of methotrexate is hair loss, alopecia. The nurse should instruct the client to report any significant hair loss to the healthcare provider. Options B, C, and D are not commonly associated with methotrexate use. Question 18. A client with a history of sickle cell anemia is experiencing a vaso-occlusive crisis. The nurse should implement which intervention to promote pain relief? A. Applying cold packs to affected areas. B. Administering intravenous fluids rapidly. C. Encouraging frequent movement and ambulation. D. Administering opioid analgesics as prescribed. Answer. D. Administering opioid analgesics as prescribed. Rationale. Vaso-occlusive crises in sickle cell anemia are painful episodes caused by the blockage of blood flow by sickled red blood cells. The primary intervention for pain relief during a vaso-occlusive crisis is administering opioid analgesics as prescribed. Opioids are effective in managing severe pain associated with sickle cell crises. Options A, B, and C are not the most appropriate interventions for pain relief during a vaso-occlusive crisis. Question 19. A client is prescribed isoniazid, INH, for the treatment of tuberculosis. The nurse should instruct the client to avoid which food or beverage while taking INH? A. Milk. B. Coffee. C. Grapefruit juice. D. Alcohol. Answer. D. Alcohol. Rationale. Alcohol should be avoided while taking isoniazid, INH, because it can increase the risk of hepatotoxicity, liver damage. INH is metabolized in the liver, and alcohol can further burden the liver, leading to potential liver damage. Options A, B, and C are not contraindicated with isoniazid. Question 20. A client is prescribed prednisone for the treatment of acute exacerbation of asthma. The nurse should instruct the client to take prednisone at which time of day to minimize adrenal suppression? A. Morning. B. Afternoon. C. Evening. D. Bedtime. Answer. A. Morning. Rationale. Prednisone is a corticosteroid medication commonly used for the treatment of asthma exacerbations. To minimize adrenal suppression, the client should take prednisone in the morning. This is because the body naturally produces higher levels of cortisol in the morning, and taking the medication at that time aligns with the body's natural circadian rhythm. Options B, C, and D are not the optimal times for taking prednisone to minimize adrenal suppression. Question 21. A client is admitted to the emergency department with a suspected opioid overdose. The nurse should prepare to administer which medication as an antidote for opioid toxicity? A. naloxone, Narcan. B. Atropine sulfate. C. Flumazenol, Bromazicon. D. Digoxin immune fab, Digibind. Answer. A. Naloxone, Narcan. Rationale. Naloxone, Narcan, is the antidote for opioid toxicity. It works by reversing the effects of opioids, including respiratory depression and sedation. Naloxone is administered intravenously or intramuscularly in cases of opioid overdose to quickly reverse the opioid's effects. Options B, C, and D are antidotes for other types of drug toxicity. Question 22. A client with chronic kidney disease is prescribed a phosphate binder. The nurse should instruct the client to take the medication with which of the following? A. A glass of orange juice. B. A glass of milk. C. A glass of water. D. A glass of apple juice. Answer. C. A glass of water. Rationale. A phosphate binder is prescribed to reduce elevated phosphate levels in clients with chronic kidney disease. The client should take the phosphate binder with a glass of water. As taking it with other beverages, example orange juice, milk, apple juice, may reduce its effectiveness by binding to the minerals in those beverages. Water does not interfere with the medication's action. Question 23. A postoperative client is receiving patient-controlled analgesia, PCA, with morphine for pain management. The nurse should monitor the client for which potential side effect of morphine? A. Hypertension. B. Bradycardia. C. Urinary retention. D. Hyperglycemia. Answer. C. Urinary retention. Rationale. Morphine is an opioid analgesic that can cause urinary retention as a side effect. Opioids can relax the detrusor muscle of the bladder, leading to difficulty in emptying the bladder. The nurse should monitor the client for signs of urinary retention and assess the client's voiding pattern regularly. Question 24. A client with heart failure is prescribed spironolactone, aldactone. The nurse should monitor the client for which potential adverse effect of this medication? A. Hyperkalemia. B. Hyponatremia. C. Hypoglycemia. D. Hypocalcemia. Answer. A. Hyperkalemia. Rationale. Spironolactone is a potassium-sparing diuretic used to manage fluid retention in heart failure. One of the potential adverse effects of spironolactone is hyperkalemia, elevated potassium levels. The nurse should monitor the client's potassium levels regularly while on spironolactone and instruct the client to avoid potassium-rich foods. Question 25. A client with major depressive disorder is prescribed fluoxetine, Prozac. The nurse should monitor the client for the therapeutic effect of fluoxetine, which typically occurs within which time frame? A. 1 to 2 days. B. 1 to 2 weeks. C. 2 to 4 weeks. D. 6 to 8 weeks. Answer. C. 2 to 4 weeks. Rationale. Fluoxetine is a selective serotonin reuptake inhibitor, SSRI, used to treat depression. The therapeutic effect of fluoxetine usually takes 2 to 4 weeks to become evident. The nurse should closely monitor the client's mood and depressive symptoms during this period and provide support as the medication begins to take effect. Options A, B, and D are not the typical time frames for the therapeutic effect of fluoxetine.